The Regen.md protocol, why we treat the hand, not the code. If your hand hurts, the standard medical model has a very predictable path for you. You visit a specialist, you get an MRI, they look for one point of failure, and they offer you one treatment for one diagnosis: carpal tunnel syndrome, or perhaps thumb basal joint arthritis. They pick one, they bill for one, and they ignore the rest. That is the industrial model of healthcare. It is built to satisfy insurance billing requirements, not to fix the human body. The reality of the human hand is that it does not function in isolated silos. It is an interconnected masterpiece of leverage, tension, and stability. When a patient walks into my clinic with hand pain, they rarely have one problem. They have a cascading failure. If you have carpal tunnel symptoms, there is a very high probability that you also have degenerative changes at the base of your thumb. In the carpometacarpal or CMC joint, research has confirmed this for decades. Treating the nerve while ignoring the mechanical instability of the CMC joint is like trying to fix a recurring engine misfire. By changing the spark plugs but ignoring the fact that the fuel line is broken, the car will not run and your hand will not heal. Insurance companies will not pay for this reality. They force physicians into a box defined by a single CPT code. If you want to treat the median nerve, the joint, the tendons, and the ligaments, you are effectively asking for multiple codes. The system denies this. It labels it as unnecessary complexity. So the average physician plays the game. They treat the one area that is easiest to bill, they send you home, and when the pain returns, they tell you it is time for surgery. At Regen.md, we reject that model. We do not practice billing code medicine. We practice systemic restoration. When we approach hand and wrist pain, we evaluate the entire terrain. We use high-resolution ultrasound to visualize the hand in real time. We are looking for the nerve entrapment in the carpal tunnel, yes, but we are also auditing the structural integrity. This is why we perform multi-site injections. We use ultrasound-guided hydrodissection to separate the median nerve. From the inflammatory adhesions that are choking it, this is not just a steroid shot. We use that space to guide platelet-rich plasma, or PRP, directly into the nerve sheath and the architecture. PRP is not a mask for symptoms. It is a biological signal. It recruits your body's own growth factors to stabilize the tendons and repair the microscopic tears in the ligaments that support your thumb. When you stabilize the CMC joint and decongest the median nerve in one session, you are restoring the balance. We have seen the data. Studies consistently show that PRP provides superior long-term functional recovery compared to the temporary relief of steroids. This approach is more time-intensive. It requires more diagnostic skill. It demands that I, as your physician, look at the entire hand rather than looking at a billing spreadsheet. If you are looking for an insurance-approved assembly line, you are in the wrong place. If you're looking to actually fix the underlying dysfunction and return to your life with a functioning hand, that is exactly why we built the Padda Institute. We do not treat codes, we treat people. Welcome to the future of pain management. Welcome to Regen.md.